Okay, students, what we're looking at today in this particular video is we want to continue to look at the osseous system, and we want to look at, in reference to the osseous system, we want to continue to look at the skull to finish up a couple important applications here. Okay, so we talked in the previous video about a number of different concepts associated with the skull, and we want to continue by looking at a couple. And one of the things that we do want to look at is we want to look at, again, the internal aspect of the skull, or that is to say the cranial fossa, or the inside of the cranial vault. That's going to be important for us to see. So we want to look for just a second here. We're going to remove the nervous system again. And as we talked before, we saw this as the occipital bone. I do want to mention, too, that we did see this sphenoid bone. In between these two is a region right here. This is known as the clivus. The brainstem does reside in this region. It's known as the clivus. It's kind of a smooth region that's anterior to the foramen magnum. Parts of the brainstem reside there, which are really, really important for us. Obviously, a life-threatening condition if we cannot maintain the anatomy of the brainstem within the cranial vault. Now, as we move to a couple other bones, we want to see this one. This is obviously in the anterior cranial fossa. There's a bone right here known as the ethmoid bone that has multiple parts. If we spin this around and look at it, the ethmoid bone is here. So what we want to do is pull this out, and here is the ethmoid bone itself. This is an anterior view. If we look, it has this very vertical piece. This is known as the perpendicular plate of the ethmoid bone. This forms the the posterior superior aspect of the nasal septum. So if we get rid of this, we'll put that back in the skull, you can see exactly where that is. Okay. Now if we look at this again, you'll notice that it has a couple of things known as the nasal concha. Here you see what's known as the middle nasal concha, and it actually has a superior nasal concha as well. It's a smaller region, difficult to see even here, but this is the middle nasal concha. If we look back at where these are in the skull, we make this just a little bit bigger, we can see that these are scroll-like bones found on the lateral aspect. Here you see the middle nasal concha right there. Found on the lateral aspect of the wall of the nasal cavity. And also, just a note, here you see the inferior nasal concha. This is a separate bone all to itself. Okay? So these are sometimes known, there are three pairs, superior, middle, and inferior. You don't see the superiors here. These are sometimes known as the turbinates collectively, because they cause the bone, or they cause the air entering the nasal cavity to be turbulent, and therefore to be moistened and warmed as the air enters. Okay, so let's go back and look at the ethmoid bone. If we look at this bone, we can see, whoop, that's our vomer. We're not ready for him yet. If we look at the ethmoid bone here, we can see that part of the ethmoid bone sticks into the cranial vault, and it's this part right here. Notice it has a vertical projection, the crista galli. If we look at where this is located, we're going to exit from here. I'm going to show you where this crista galli is actually found. If we spin this around and we look back inside the cranial vault, here is the area of the crista galli, right there. It sits vertically, still part of the ethmoid bone, and adjacent to it laterally are the areas known as the cribriform plate. And you can see within the cribriform plate there are many, many little holes. Those little holes that you see, trying to get this just right for you. Those little holes that you see are the olfactory foramina. And those olfactory foramina transmit the olfactory nerves. And it's not uncommon for a patient to have head trauma and cause the brain to actually slide back and forth in the cranial vault. And when that happens, it will, because the brain will shift, it will shear off those axons and the patient will lose all the ability to perceive smell. We know that this is known as anosmia. They will lose the ability to perceive smell. And something that you may or may not know is along with this, obviously that patient is going to lose uh, a significant amount of the ability to taste. But one thing that they've discovered in the last 10 years is also they will lose a lot of the ability to form new memory. Forming new memory is something that's highly dependent upon smell. You guys can probably figure out that that's true. You know, if you smell something, many times you'll have a rush of memories if you smell that before, maybe a food you got sick on, or an alcohol you got sick on, or maybe a perfume of someone you were emotionally attached to, and you have a big flood of memories of where you were and what you were doing. So smell has a very powerful influence on memory. And it is true that aromatherapy is now being used with patients that are suffering from cognitive decline or dementia, and there are some pretty encouraging results. Okay, so those are parts of ethmoid bone. And yes, the crista galli can be, you'll hear people say, well, if you hit somebody in the nose, could that push the crista galli up into the brain? And the answer to that is really yes, it could. It is possible. All right. So now we want to look at a bone we saw just before that forms the posterior, and here you can see it, posterior inferior part of the nasal septum, and that is the vomer. Kind of a plow-shaped bone. You see it right here. This is the vomer. So you can see where this is actually found inside the nasal cavity. Okay? All right. So we've looked at a number of different bones, and we're going to go back for just a second, and we're going to see if we can look at the entire skull here and look at the complete skull for just a minute. We do want to take a minute to look into the orbit. When we look in the orbit here, we're going to see a number of different things. One thing that we see is this hole right here. This is known as the optic foramen or optic canal. This is where cranial nerve 2, the optic nerve, actually passes through to go toward the brain. Okay, so it's really a canal because it's an extended or elongated foramen. Then, if we look lateral to that, you see this. This is the superior orbital fissure. This is the superior orbital fissure, and you can see that we will actually, it's a passageway for really cranial nerves 3, 4, 6, and a part of cranial nerve 5 will pass through there. Okay, well, if we have a superior orbital fissure, then we're obviously going to have an inferior orbital fissure. And that inferior orbital fissure is going to be right here. So right here's, here is the superior. The inferior is right there. Move down so you can see, there you go, see it right here. That's the inferior orbital fissure. So you can see both of those. Okay, so those are lots of things found in the orbit, and there's also part of the ethmoid bone there. There is a small bone right here. This is known as the lacrimal bone. And this lacrimal bone has a passageway. That's where it is. It has a passageway in it. You can see a little hole right adjacent to it. That's the nasolacrimal duct. So there's the lacrimal bone. I don't know how much that helps you. That's an awful big view, but you can see this area where there's a lacrimal fossa, and the duct would be here. There is a procedure, oftentimes in kids, this nasolacrimal duct is not big enough, and they can do a procedure. It's a pretty cool name. It's known as a conjunctivocriostostorhinostomy. Very long name. They can stick a cannulus down in there to make that larger so those kids' tears will actually drain more effectively. Okay, so we've seen that. I do want to take a minute and look at the inferior aspect of the skull. And we want to look at some of the foramen that are around here. And to do this, I'm going to pull off of the parietal bones here. And now we're going to have the ability, when we turn this around, to look and see some holes or foramen in the bottom of the skull. Here is, just so you know, the hyoid bone. Very unique bone, not part of the skull, really part of the thorax or the cervical region. It doesn't attach to any other bones. The hyoid bone is one that does not have a direct attachment to other bones in reference to a joint. Very important for us for the process of phonation or speaking, and also deglutition or swallowing. But we're going to hide that for right now. And we're going to look at the inferior aspect of the skull. We're going to hide a couple little ligaments for you here too. All right, and we want to look at some of the foramina. Here we see a foramen. This is known as foramen lacerum right here, foramen lacerum. Then you see here the foramen ovale. It's somewhat oval shaped, so they call it foramen ovale because of its oval shape. Then you can see lateral to it, this is the foramen spinosum right here, a small foramen. Then you can see we've already talked about the stylomastoid foramen. Again, that would be between the styloid process and mastoid process of temporal bone. So here we saw the styloid process. Here's the mastoid process between them, stylomastoid foramen, obviously one on each side of the skull. And then I'm going to show you this one, a little bit more difficult, adjacent or near the occipital condyles. This large opening is the jugular foramen. Okay, very large. We know that the jugular foramen, actually what passes through here is, or begins here, is the internal jugular vein. And then we see near it this passageway right here is known as the carotid canal. That carotid canal actually allows for the internal carotid artery to enter the skull. And then we see a small passageway near these occipital condyles. This is the hypoglossal canal. The hypoglossal canal allows the passage for cranial nerve 12, the hypoglossal nerve. Okay? So those are some of the important foramina. There is another one I want to show you, another foramen, and this is a foramen. Let's get rid of this occipital bone for a minute. And we can see this guy. This is foramen rotundum. We see him there, really best visualized on the internal aspect of the skull. Okay? All right, guys, any questions up to there? Hopefully you're doing well. Okay? Shouldn't be too difficult for you at this point in time. All right, we want to go back and look at the full view of the skull here real quick. All right, so we've done a pretty decent job of reviewing a lot of the information on the skull. I want to add just a couple things. Remember the sutures. We have the frontal or coronal suture, the squamous suture here, the lambdoid or lambdoidal suture here. This is known as occipitomastoid suture. We see it there. And in a child, in an infant skull, there are fontanelles that we see. Some people used to call them soft spots or fontanelles. The kids have a number of fontanelles. They have one here, a sphenoid fontanelle. They have an occipitomastoid fontanelle. And then on the top of the skull, the vertex, they'll have a posterior fontanelle. And then here they would have an anterior fontanelle. And this is really the last one to close, somewhere between 6 months and maybe extended up to 2 years. Those fontanelles are basically just membranes. These cranial bones have not united, have not formed a full suture yet. You don't want to mess with those. They can be signs of, they should bulge with increases in intracranial pressure. You can see this sometimes when kids cry, or maybe if they're dehydrated, there's severe sinking, a severe sunken-like depression of those fontanelles. Okay? And obviously, because those cranial nerves aren't united, there is the possibility that if there's increased pressure, that the cranial bones could expand and a hydrocephalus uh, could actually occur. So kind of important with that increase in intracranial pressure. Okay. All right, guys, that's pretty much it for the skull. And now, when you go to your next video, we'll be looking at parts of vertebral column and other structures. Okay? All right, kind of an important, just kind of a chance for us to look at a couple different things. All right. So what we want to do, take a second, let's look at a couple different views here. One thing that we could do is we want to focus down and look at the skeleton here, but we're going to look at the vertebral column. Okay, we want to take just a second to see if we can figure out where this vertebral column actually begins and ends. Okay, guys, so what we want to look at here is we want to take a look at the vertebral column. And as we look at this, here you can see the vertebral column. We want to look at a couple different things. We're going to remove a couple of the structures if we can. But we can see that there are really 4 different sections here. We have a cervical region here. It's the first 7 vertebrae. Then we have the thoracic region. Oops, sorry about that. The thoracic region, which gives us our the thoracic region, which gives us our 12 vertebrae. Then we have the lumbar region, which has 5 vertebrae. We see those down here. And then we have a sacrum. Okay? This is the bone right here, the sacrum. Okay. When we look at this, we know that there are different curves. Notice that the cervical spine has a convexity anteriorly. They call this a lordosis. Then you can see that in the thoracic spine, we have a convexity posteriorly. That is known as a kyphosis. Then we see a convexity anteriorly in the lumbar spine, another lordosis, and another kyphosis in the sacral spine. These are normal. It's just a hyperkyphosis and a hyperlordosis that are abnormal. And obviously, you've probably heard of scoliosis. That is a rotary and lateral movement of the spine. Scoliosis is always abnormal. Okay, so when we look at the cervical spine, we can see these vertebrae. Now, what we're going to do is pull out a vertebra here, see if we can identify a couple individual vertebrae for you guys to look at. Okay. All right. So when we do this, all right, let's see if we can find a vertebra for you here. All right. So this is pretty much a typical vertebra. So we're going to spin this one around so you can look at it. And just so you know, this is a superior view. We're looking at this from above. When we look at a vertebra, what we note is that there is a vertebral body. We also see there is a couple areas known as pedicles. These are these small areas right here, the 2 pedicles. We have transverse processes. We have 2 lamina, and we have a spinous process. The pedicles, the lamina, and the spinous process help to show that there is actually a hole here. This is known as the vertebral foramen. However, If we line up multiple vertebral foramen, then we end up with what's known as the vertebral canal. And obviously, one of the things that are found within the vertebral canal is going to be the spinal cord. We also see the transverse processes. Notice in a thoracic vertebra how long the transverse and spinous processes are. They're very, very long. Something else to note here. Notice that here we have a notch. We have notches here, and on the inferior vertebra below, we'll have a notch. These notches form the intervertebral foramen. Also note right here we have a superior articular process and an inferior articular process. Superior and inferior articular processes. And on the surface, if you look at these real close, there's a flat, not that close, a flat area on the superior and inferior articular processes. This is known as the articular facet, a smooth area lined with hyaline cartilage. Okay, those are where the vertebra actually articulate or form a joint with each other. Okay. So we really have a number of processes here on this vertebra. These are typical things found within a vertebra. So if we exit this, we stick that back in the spine, most of the vertebra look like that. They have a lot of similarities. There are some special vertebrae. Now let's look at a lumbar vertebra. If we look at a lumbar vertebra, what we see are a couple different things. Well, that's T12. Let's look at a lumbar. It looks very much the same. Obviously, the spinous process isn't as long, but the other structures are all there. These hold much more weight. There is a special thing here. If I set this up just right, you can look, and this almost looks like it's real common to see a fracture right in this vertebra. There's a fracture right through here. Okay, and radiologists refer to this as the Scotty dog. So this would be the head of the Scotty dog. He's maybe got a little ear right here, or an eye and an ear, a front leg and a back leg, and there's often a break that goes right through here. It's known as a spondylolisthesis or a spondylolysis. Okay, so it's actually a fracture of that lumbar vertebra. Okay, so they look pretty similar. I will point out to you one thing different in a thoracic vertebra. Because there are ribs associated with the thoracic vertebra, the thoracic vertebrae have this on their transverse process. They have this faded area right here is known as the transverse costal facet, and that's for an articulation with the rib. And then you'll also see on the body of the thoracic vertebra right here, if you can see this flattened area, they will have superior and inferior costal demifacets. It's D-E-M-I. So superior and inferior costal demifacets. Those are specific to thoracic vertebra only, okay? All right. Those demifacets are pretty specific. They're only found on thoracic vertebra. Okay. Now, what about cervical vertebra? Well, if we go back and look at the cervical vertebra, if you guys look, a typical cervical vertebrae looks pretty much the same. Some of them have a special thing that you see here. Some of them have a bifid spinous process. It does look a little bit like a smiley face because there is this, a transverse foramen, a foramen in the transverse process of cervical vertebra. that foramen houses the vertebral artery. Okay, so this transverse foramen is only found in the C7 through C1 vertebra. So that's how we named them. Remember, so if we have 7 cervical vertebrae, we name them C1 through C7. If we have 12 thoracic, it's T1 through T12. If we have the lumbar, 5 of them, it's L1 through L5. So that's how we name them. The sacrum is just named as 1. In this transverse foramen, we find the vertebral artery. That actually enters at C6, does not go through the C7 transverse foramen, enters at C6, goes all the way up through all the other transverse foramen, and then turns posterior medial and goes through the foramen magnum to supply blood to the brain. Okay? All right. So it and the internal carotid artery are going to supply blood to the brain. So that's a typical cervical vertebra. Let's look at 2 special ones. This is the atlas. This is C1. You'll immediately notice a couple things about the first cervical vertebra. There is no body to this, okay? There's no body to it. It has an anterior and posterior arch, and it has an anterior and posterior tubercles, so there's no spinous, okay? Also, what we note about this is that this is sometimes called the atlas, C1 or the atlas. We notice also these large structures here are the lateral masses, and yes, they're going to have articular facets on them, and that would articulate with the occipital condyles, and then the inferior articular facets would articulate with the superior articular facets of C2, or the axis. If someone gets struck on top of the head, it can cause this C1 vertebra basically to break open, and cause it to break what they call a burst fracture, and it will move laterally, sometimes called a Jefferson's fracture. That's with axial trauma, obviously not a good thing. And then we can look at the C2 vertebra, which is here. This one is different, sometimes known as the axis, and it's because it has C1 sitting on top and rotating, and obviously C1 would sit and rotate on this thing. Very special process. This is the odontoid process, or the dens. And this is really, if it's known as odontoid, this is really the embryologic remnant of the C1 vertebral body. Because the C1 body is not attached to C1, it actually migrates down and becomes part of C2. Everything else looks similar to a regular vertebra. It's not uncommon for patients, especially in a motor vehicle accident, because there's a little ligament, the transverse ligament that runs behind this dens to hold C1 there. It's not uncommon for patients to fracture this C2 vertebra kind of at an angle here, sometimes known as a hangman's fracture. And that obviously can be very, very devastating and potentially life-threatening. There's also, you can fracture just the dens, break the dens right off there. And then we would have major problems when patients want to flex their head or like nod their head forward. The C1 vertebra can actually slide forward, compressing the cord if there's a fracture of the odontoid or dens. Sometimes people are born, and obviously that's indication for cervical intervention because that has to be stabilized. Sometimes patients are born without odontoid or dens, what's known as os odontoideum. That could be very serious, obviously, because that patient could have an unstable cervical spine. So there are lots of different things that could happen there. But that's C2, or what we call the axis. So kind of special vertebra. There you see the famous ligamentum nuchae, or nuchal ligament. We mentioned that before. we ought to go down and look at the sacrum itself, a very interesting bone here. Typically 5 vertebral segments fused together. This is the posterior view. You can see it has the superior articular processes with their facets that would articulate with the inferior articular processes of L5. Here is the median sacral crest. This is really known as median sacral crest. They are kind of the analogs of spinous processes. So together they call them the median sacral crest. Here you see the posterior or dorsal sacral foramina. And obviously you have dorsal, guess what? You're going to have ventral. And it looks like the same hole, but they're really not. Those are not the same holes. If we turn this laterally, you'll see that this is the most anterior part of the sacrum. This is known as the anterior the sacral promontory. This is the most anterior part of the sacrum. And there are sacral ala. These are these lateral regions right here, these sacral ala. Ala means wing, looks like a wing. And a really interesting thing, if we look down in there, you can see the sacral canal. This is a canal in the sacrum where the inferior aspect of what the cauda equina or nervous system passes through there. And then it goes down to here. Very interesting spot. This is the sacral hiatus, this opening that you see down here. The sacral hiatus. That sacral hiatus is important. Believe it or not, it's the only naturally occurring spina bifida that you see in the human. You may have heard of a spina bifida. It's a congenital defect. So this is the only naturally occurring spina bifida in the human. It is possible also for patients to have an anesthetic placed into that region to help anesthetize some nerve fibers. Okay, so that's the sacrum. Okay, guys, that's really it for the vertebral column. When we speak next, we're going to go over some of the thorax information. Okay? All right, have a great day.